Hello, ladies and gentlemen. How are you guys today? I'm Toya Algarin, and this is bringing resources to the community. And on the show tonight, we have Elaine Wells, Auntie Elaine, of course, and we have Missy. I'm gonna call you Missy Moore. Missy and I went to high school together. I'm not gonna tell you what year that was. Okay, that's just not gonna happen for me tonight. But I will tell you that she was my partner in crime, and we graduated in somewhere in the
19 of
80s. Sometimes during the 1980s, which is yeah, a while back, huh, Missy?
Mhm.
So how you been lately?
I'm doing great. I'm doing great. Absolutely doing what I love, which is healthcare, and supporting patients and families. That's the bulk of my life work.
Right. So
Mhm.
I asked my girlfriend Elaine to join because actually, to be honest with you, she and I are in the educational space, right? At
Okay.
the same time, we find ourselves taking care of our family, right?
Okay.
And
Hi,
that's what I'm.
Auntie Elaine.
Hi, very
Hi.
nice to meet you.
Yeah.
So yeah, free feel to introduce yourselves.
Yeah.
Um, yeah. So anyway, I'm gonna keep going. But anyway, so the reason, well, actually, Elaine, just let me tell you. First of all, Auntie Elaine doesn't like to do anything without being prepared. Okay. And the funniest thing is she got me into like, writing down questions and talking to the person beforehand, you know. So basically I talked to Missy Elaine a couple of weeks ago. I can tell you a couple of weeks ago, right? And we came up with this whole platform and everything we wanted to discuss because we, find a need like how do you develop a relationship with your provider, your
Mhm.
healthcare provider, right?
Mhm.
And I had a story and blah blah blah. But since I talked to Missy, okay, things have happened in my life. All right. So I'm 59 years old. And right now I find myself as they call like the sandwich person. So I have children that I'm raising and I'm taking care of my mother.
Mhm.
Right. But since I talked to you ladies last, my sister is 70 years old, 77 years old. And now, right now, I'm taking care of my sister.
Mhm.
Okay. And my mother and my children.
Mhm.
Right. And the reason being is so, the virus was tough for everyone. Right. So I don't know about your mom, Elaine, but I know she missed some doctor's appointments during the last COVID year. Right.
Hmm. Yep.
So my sister was the same way. So finally, she's trying to get caught up, and she goes take a routine blood work. You get your blood work done to make sure all your organs are operating, especially if you're taking certain medicines, and they check for your cholesterol, they check for all these things, right? So
Right.
they checked to see if she had sugar diabetes. So she comes back with a sugar diabetes diagnosis, right? So they give her the diagnosis over the phone and said, "We need you to take this medicine." And then they said, and then she's like, "Okay, so what should I eat? What does this mean? Blah, 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 blah." And they tell her, "Call this number and they'll explain everything to you. You get an appointment and they'll explain everything to you."
Mhm.
Well, that was in May. It's June, and the appointment's not until July. Like, okay, right? So
You just
then
until then, I guess, huh?
Right. So then wait, it gets better though. So she calls, I'm like, Joyce, that can't be. Call and see if you could get a quicker appointment. Maybe it's a teleconference or whatever. They call her back with a teleconference. She had to fill out 8 pages of paperwork that they emailed her. First of all, she has her cell phone. She doesn't use a computer. She is 77. She does have a tablet. She doesn't have a printer, nor can she navigate any of it.
Right.
You know what I mean? Then they give her like going to myhealth.com or whatever, sign up for that. I was like, how do you navigate that? So then finally she gets a phone call. She calls the people back and tells them, like, I really can't do this like that. And they're like, okay, we'll have somebody call you and we'll just, do it over the phone. All right, that's great. The other thing is this. So over the weekend, she has rheumatoid arthritis, really, really bad. Like hands are deformed, knees are bad. She needs to get knee surgery, right? Knee replacement. Hands are not working. She is paralyzed with pain, and she calls me and is like, disarrayed. I don't know if she took too much medicine. We go to the hospital. We get at the hospital, in the hospital emergency way, the ambulance. We get to the hospital. They, check everything. Oh, she's okay. She's just in pain. Can you take her home? She can go now. After 2 hours. And I was like, oh my God. So which doctor is talking to which doctor? How is she supposed to navigate the paperwork? How is she supposed to find out how to eat? I'm sending her recipes, but like I said, like technology is not her friend,
Right.
and I'm ooh.
Wow, that's a lot. That's a lot to unpack. That's a lot to unpack. But I want to start with this part, the self-care part. That means you. That means my auntie. I want you to get to a space to where you're not overwhelmed either, because you're the helper. And both of you can't be overwhelmed at the same time. So whatever it is that you have to do, and we'll talk more about that after we get to the issue at hand. I'll speak about myself personally, because I had that. My son was very ill, and I lost my son to cancer, and it felt like everything was on me. I was still working as a caregiver, still working in a job, and finally I kept something. I'm going to have to take a piece out for myself, whatever that is, whether it's a walk in the park, whether it's a ride, whether it's something. Now let's talk about your sister. I realized that they probably gave her the diagnosis over the phone. That isn't really the best scenario, but because of COVID and everything else, I could see why they did it. The piece that's the most important is everything is fragmented right now. Some of it has to do with COVID, and some of it has to do with just poor follow-up, making sure people get what it is that they need. And the other is they should be more conscientious about a 77-year-old with rheumatoid arthritis that has problems with her hands. Like, they more than likely gave her metformin. And if they gave her metformin, it comes in a big bottle. And if it comes in a big bottle and she has arthritic hands, she can't open it. But, just from me knowing what I know, and that makes older people feel defenseless, like they don't know what's going on. So one of the things that I always try to advise, if possible, you can call your insurance company, or you can call the local office on aging and ask them to assign you a case manager. A case manager it can be either be a registered nurse, or it's a social worker who is familiar with all of the services that are required, that are available to older adults. So let's go down the case management, the case manager route, or some people call them caseworkers. You get a caseworker, they come in and they do an intake, and they ask you questions about the patient. They ask you questions about your family life. They ask you who cares for whom. They check the functions of the patient, what they're able to do and what they're not able to do. And then they'll do intake on different services to see what the patient might be eligible for. Once you get the eligibility, then they'll tell you what programs that the patient can get that can support you in what it is that you need, especially if you're caring for the patient at home. And my rule of thought is take whatever services that's offered to you. It's better to have them all piled on and let the services fall off that you don't need. than to say, oh, no, I don't think I want that. Once they've decided that, once they've, first of all, eligibility is tough. So if you're eligible for something, you need to take advantage of the eligibility. Once your family member is eligible for a program in your state, find out how you can utilize it. Sometimes it may be a caregiver. Sometimes it may be somebody comes and does minor repairs to your house, like put a ramp for a wheelchair or come and rake your yard. You never know what it is. Take advantage of what it is that they have to offer you. When it's time to research, some programs require that you recertify every 6 months or every year. You just make sure that those things are done, because not only is it a help for the patient, it's a help for the caregiver too. You have to take, what, sometimes the help doesn't look the way that you think that it's going to look. You'd be like, I don't need that. Well, you know what, you don't need it right now, but on a very particular day when you're very tired, you just may need it, and you don't know when it's going to come in handy that you can use it. So just think, even if you don't need a service right then, just keep it in the back of your mind, because at some point you may need it, like a ride to get to appointments. You say, oh, I take my mom myself until your car break down. But guess what? If you already signed up for the rides, then you can call them and say, I'm going to need a ride. I'm going to go with her or go with him to the appointment, because that's a program that you have set up already.
So Auntie Elaine, how are you feeling about these resources?
Well,
or lack thereof.
Anybody who knows me, so I won't say there's a lack of resources. What there is a lack of knowledge about the resources and how to get the resources. Because for whatever reason, in our community particularly, we don't share this information. So a lot of the things, anybody who knows me knows I am an overuser of resources, if that's the thing, right? That's the first place I go. If I have to do anything in my life, even something as simple as food shopping, a resource for food shopping, coupons, right? Coupons and what do you call them? The customer reward cards where you get shopping, that type of thing. All of that's resources. And we need to be mindful that using resources is not like, so sometimes it's a pride thing with us, that's my mom, I can take care of it. And I agree 100%. When when my mom has to go to her doctor's appointments, I move heaven and earth. We move stuff around. It's 4 of us that drive. Who's mommy, who's going to take mommy. Office of the Agent in Delaware County was the best thing since sliced bread for us. Because you know what? They come and pick her up at the door, take her to her appointment, outside the doctor's office 5 minutes before the appointment is off. She, built up a rapport with the driver, and they're like the best of friends. She feels comfortable riding with the lady. And it's a load off of us who, like you, Toya, are raising kids. I have teenagers, and sometimes we're helping out with the grandkids, and then we have our parents, right? So, or in your case, your sister. Yeah, resources.
Resources, and it's so compartmentalized, and that's the reason why I say to try to get a case manager. So for instance, with your sister, Toya, you can call the insurance company, or you can call the hospital that she's affiliated with, and you tell them, you know what, my sister was just recently diagnosed with diabetes, and we have nowhere to turn right now, and we really need basic information. Now, one of the resources that you can use is the American Diabetes Association. They have a lot of good information. I actually sit on the board of the American Diabetes Association consumer board in the District of Columbia to support people that have diabetes. For me, because I'm a woman of color, I work mostly with people of color, because it has a lot to do with tradition and culture in the way that diabetes is managed. Older Black people be like, well, if I take this apple cider vinegar, my blood sugar gonna go down. And if they do have all kinds of things because they don't want to take medication and things like that. The other is that we have to look at food, the impact of food, and that type of thing in regards to managing diabetes. So it's bigger than just taking the pill, also getting supplies that she need. They told her to take the pills, but they didn't tell her to check her blood sugar. So you don't know how often. If she has Medicare, then she can get a glucometer for free, along with the things to do her blood sugar, but you have to have a physician's order to do it. But if you don't know all of those things, they just give you pills and send you on your way, which is really inappropriate for a 77-year-old. So you have to call the team on their stuff, because things fall through the crack. As a healthcare professional, this is my 35th year as a nurse. I don't want to think that people are intentionally negligent. What I do think is that it's a lot of different things going on, and sometimes you have to call people on it. So Toya, the first thing I would do is call the physician's office back, tell them that you need a glucometer for your sister, and you need an order for it because you need a prescription to get the glucometer and the strips. You need to find out how many times a day they want her to take her finger stick. Find out.
Come out to show her how to use it?
They do. Now they can have somebody come out to show her how to use it. It can be a home health company. If she has Medicare, home health can do, what they can do is medication management and diabetes training, which is a skilled need that's covered by Medicare at 100%.
Mm.
So you can have the physician's office order her home care for, say this specifically, medication management and diabetes education.
Okay.
I'm writing this down. So I mean,
I know you are.
I
know you're writing it. I know you're writing it down.
And the funniest thing, like, I mean, we had this whole Zoom call planned.
Right.
And we had topics and we were like going to go on, but at the same time, real life jumped in and happened, huh?
Well,
and it happened with you know, like I'm just blown away how it was just thrown on her, and they thought that she could navigate this whole entire process. So, like you said, is one doctor talking to the other. Well, the meds, like, and you know what? To be honest with you, you know how many herbs she got upstairs? When I took her meds to the doctor, right? The herbs, the vitamin D, the garlic, you know, the echinacea, the whatever. She has like millions of. I'm like, dude, what are you taking?
Well, I'm glad you took it, because most people don't, and it's important that you do, because a lot of medications interact with people's herbs and vitamins, and you may not get the efficacy that you're looking for in medications. If it's herbs, if it's vitamins, over the counter, even preparation, you know, people are doing apple cider vinegars and gummy things and all of those other things. Those things are important to take as well.
Wow. So my next question for you is, I guess we have just talked about the health disparities that affect the Black community.
The disparities are real, and this is a very important point I want to talk about, which is why I feel like, you know, my work is so important. It was a study done in 2015 by the Institute on Medicine. The Institute on Medicine said that less than 50% of the people who get healthcare instructions understand what the people are talking about. So they don't understand their healthcare instructions. So having said that, I mean, that's so important. So it's not that people aren't doing what they're supposed to do. More than half of the people don't understand what they're supposed to be doing. And that's a big difference. Not doing it, knowing it and not doing it is one thing, but not understanding it is something different.
You know, and the craziest thing is that makes sense what you said, but suppose the person has dementia.
That's right. That's right.
You know what I mean? Suppose the person is like at that age where your family's not really paying attention. You know what I mean? And to be honest with you, she's upstairs and I'm not going to be like too loud about it. I was thinking like maybe it's oncoming. You know what I mean? And yeah, I just want to introduce the audience. I got my two girls on here. Missy's Wi-Fi is in and out, so we're going to continue the conversation just in case you go out, Missy.
Okay, thank you.
Yeah, that's why I had my two other girls come on. But
No
we're also in this space with like education and advocacy. And I just talked to Renee the other day, and Renee was like, we need to be in the healthcare fight as well. So Renee, introduce yourself real quick since you're on. We don't want to ignore you.
Hi, I'm Renee Brown. I don't know what you want to say to you. Like,
Just do you, Renee.
oh goodness. This is the healthcare space, so I mean we need to be on top of everything, but we have to just get better as ourselves, because I had a grandmother who had dementia, and I was the one who advocated for her to get my mom to get power of attorney. I advocated for her to find a new doctor, which that process was hard because a lot of people do not understand the African American dementia person. Sundown syndrome is real, and how to deal with that. Just, I'm here for it all. I studies all, jack of all trade, master of none. Here we go.
That's probably all of us, I think. Yeah, one of the things that I talk about is a partnership with your healthcare providers, because I know that a lot of people, especially older people, they kind of come in like, well, I'm doing what the doctor told me to do. But if you think about it more of a partnership, then it's give and take, that you're communicating good and bad between the two of you, because that helps. It helps the patient and the family make better decisions. I'll give you an example. I have an insurance company, and my physician left. They gave me a new physician, and the new physician came on, and she said, "Oh, you know what? They have medicines that are cheaper now that we can do. So I'm going to change all of your medicines to something else." I said, "No, you're not going to change my medicine." I said, this was a process for the other physician to get my blood pressure under control. I said, "I don't know if you read my chart or not." I said, "But I had a stroke when I was 32. So I said, it's important that we keep this regimen that we have now. Now, if that's going to be problematic, then maybe I need to consider somebody else."
And we have to be okay with saying it. That's just,
You have to be okay with saying that,
okay with saying that. No doctor, I've left doctors for less. Like right now I'm in the search of to find a PCP, a primary care physician, because they have, I don't trust too many of them.
It's a program, and I think it's called DocMed. I think it's DocMed. I'll look it up and get it to Toya, but it's on this website where you can evaluate. You can go on and get the history of the physicians, and it's important to see whether or not culturally they understand, what your experience is.
Right. It's everything for me. Like my OBGYN be like, "Renee, can you please find a PCP?" I'm like, "You know how hard it was for me to find you and stay with you. Like, so you already know." For me, that's a real thing. Even with my daughters, my daughter has tuberculosis. She has tuberous sclerosis. So she has tumors in her brain, her heart, and her kidneys. She has epilepsy. Really a kind of severe epilepsy. She has seizures every day. So I'm on point with her, with her doctors, and I have to say a point with that. But not even just that, with my uncle, he's had a stroke. I'm the one who found out and told him, "No, he's had a stroke. Something's wrong. Like,
right.
Let's get him to the emergency room, like right now." And then we took him to Presbyterian. They were like, "Oh no." I'm like, no, do the workup again, whatever you want to work up. find me somebody in here who's not too busy to sit here and listen to what I have to say. And let's figure this out right now. And when they came back, they're like, oh, did he have a stroke? I said, I told you he must have had a stroke before. And now I don't know what it was, you know. He's had a stroke, meningitis. Like, it's just been, you know, run of the gamut. But I'm a very, very big advocate for that. Like I said, I've written off doctors for, you know, much less. If you're not coming in and saying, hello, how are you doing? I'm ending it right there. I'm just, bedside manner is great for me.
It's important. And the other is you have to really be comfortable with the person that you're taking these instructions from about your health. And, you know, it's lots of people that says, you know, oh, I don't particularly care for my doctor. My aunt is going through that right now. She doesn't like the doctor. I said, well, change it.
Yep.
Well, I know I'm going to have to do it. Okay, we'll do it. Because it ain't, I said, we don't have no commitment to him and he don't have no commitment to you. I said, and the bottom line of it all is, I said, you're paying him. He doesn't work for you. I mean, I said, he works for you. You don't work for him. You got to understand that. She hasn't changed the doctor yet.
Of course, because we get in that complete, a lot of us, especially the African-American community, and I can talk a lot about that because I know I am, we are very complacent. We're like, oh, they went to school to be a doctor, so they must know what they're talking about. Oh, it is, you want me to go see the doctor now, I've seen the doctor now, this is what he said, now deal with that. You know, but for you know, I'm 44, so, you know, even like I said, I tell a lot of people, I am very, very hard on doctors. It's just, you're dealing with me, my health, my well-being, and you can't just be concerned about just that one piece, because I'm makeup. I'm a lot of pieces to this puzzle.
That's the other, you know, that's funny because that's the other thing that I wanted to talk about today is generational fear of the doctor or what to ask the doctor, the generational relationship with the doctor. Can you talk more about that, Missy, please?
Yeah, I can talk a little bit about it. Generationally, you know, if we think about it now, our kids don't have any problems going to see anybody. They go and it's in and out. They can do a video, but for us, it's very different. It's more just, and I'm talking about people in our age group. You know, we want to see face to face. We want you to give us instructions. We want back and forth. We want to have dialogue. And then when we're talking about our parents are different. They sit and listen, and then they do what they're told to do. Or at least we think they do what they're told to do. Now, in my family,
what they told to do.
Right.
Because those doctors that say, take 3 of these and they'll come right home. Like I know even my mom said, she said take 3 of these. I said, does that make sense? Why didn't you ask the question? How many milligrams is this? It had to be a mistake. They wouldn't have told me. And she gets really, you know, my mom gets really upset.
Yeah.
They wouldn't have told me if they ain't. I said, Mom, it doesn't make sense. So what we're gonna do, I'm gonna take this here from you and we're gonna call them and we're gonna wait till they call you back. Lo and behold, it was a mistake. Oh, I only meant to say 2. Right. You just rattling up, Mom, change the doctor. We're not even taking this medicine. Like, no, she's good to me. Yeah, that's, you know, but that's exactly how they are.
And you know, people still have uneasiness with healthcare providers because historically, if we think about all of the things that were done with medicine, things that were unethical, we're absolutely past that now because I feel ethics is a really, really big thing in regard to how people are managed. But older people don't care about that. They'll say, well, listen, I got some Watkins salve, and I'm gonna put this. I don't know if y'all remember Watkins salve. I'm telling my age now, y'all.
That and castor oil and Robitussin fix the world, don't it?
Listen, and some Vicks, and some medicated Vaseline. Put some of this on here and we're gonna make this work. Whatever. Okay, they'd be like going to the doctor. Oh, my grandmother did never, I never had, but you know what? I never had one childhood disease. My grandmother would make all kinds of stuff in her kitchen, salve and everything for me. And
sassafras tea, boy.
That's right.
Boy.
And I'm not knocking it because guess what? You know, one of the biggest stores that's open is all the herb and vitamin stores. So our family members weren't that crazy. No, everybody is buying it and everybody is using it. The other part of it too is a lot of people are starting to look at more physicians who do holistic medicine. So they're looking at the physical piece of it. Yes, if you break your arm, you're going to get an x-ray. However, they're going to talk to you about biofeedback. They're going to talk to you about aromatherapy. They're going to talk to you about meditation. They're going to talk to you about acupuncture. It's a lot of different things that physicians are recommending to patients and insurance companies are paying for.
Yeah, I broke my ankle. It's probably about 5-6 years ago now. And I looked at the doctor sideways because I already knew that I needed surgery. You know, the joint, the space in my joint was just off what they really would like it, like it to be. And he was like, well, you don't have to have surgery. You could do the aromatherapy. And I said, sir, look here, the way that my life is set up, thank you for being, trying to understand but what day can you schedule me for surgery? What day would that be? Because that's where I'm going to be at. But you can get some doctors to do that.
Some of them do, but the other piece of it too is that you have to be open to it.
Yes.
If you're open to it, and you're willing to try it, especially when conventional things haven't worked. I just want us to think about for a second, for instance, Toya, your sister. They're giving her all these medications. Oh, she's just in pain, this, that, and the other. Untreated pain can take you down.
It does.
It can make you depressed. It can make you anxious. It can make you overwhelmed. It can make you just not feel good. So just imagine somebody, oh, well, she in pain. Okay, well, it has to be something to help diminish the pain, because pain also messes with your immune system. So in her case,
yes.
You may want to think about, one of the things that they do for pain is heat. One of the other things that they do is aromatherapy. Another thing that they do is vibration therapy or ultrasound. A lot of different, and they keep working until sometimes it's physical therapy, until they can they have a plan for the patient so that their pain can be diminished.
Correct.
And it's not just a pill all the time, because there's only so much, it's pills that are going to keep things at bay. But, when you start to have other problems, so you have pain and you have arthritis and you're taking medicine for that, but now you're diabetic and you're taking medicine for that. But if you take non-steroidal anti-inflammatories too long, then it messes up your kidneys. And, so it's a whole lot of things that come into play. What I'm going to say is tricky to manage pain, but what I will say is that it can be done.
You have to be open. I think, especially with me going through it, it's easy to say as a, sometimes as the person not going through that pain at that time, hey, it's very easily to manage. Right. But I found that it was easier when I first got to the hospital with my broken ankle. There was that Percocet Oxy. I said, look here, the last time I took one of those, it didn't end up so nice for me. So I don't want to do that.
Right.
What else along the same line can do this? They're like, well, you're going to want this. I'm like, look here. Even me taking a half of one, it's just an undesired result. But take that thing, when the first 24 to 48 hours that you take something and you're supposed to take it like, around the clock. That's why people don't get any sleep in the hospital for real, because they're trying to get you in a regimen. We always say that, dang, you go in the hospital, you don't get no rest. Jesus, help me.
No, you don't get any rest. It's
You
not
know,
there for you to get, it's not there for you to get rest. It's
Right.
there for, years ago, people used to stay in the hospital until they got well. Now
Right.
people go stay in the hospital until they're stable. You get well at home
Correct.
or in
Right.
rehab.
But it's that management cycle that they're trying to start. Now, I don't agree with all of them, but you know, what works for you is what works for you. But for me, it was easier to start it for that first 24 to 48 hours and then to wean myself off of a lot of it.
Mm-hmm.
You know, like,
So,
but
you
that
know,
doesn't work for everybody else.
So for me, and since this is you know, how do we develop a relationship with our care partner? What is a care provider? Missy,
What was your question, Toya?
what is a care provider?
A care provider can be a lot of different things. A care provider can be somebody that's walking down the street. So, and there are different levels. It could be a physician, it could be a physician's assistant, it could be a nurse practitioner, it could be a nurse, a medical assistant, a home health aide, a CNA, a community health worker, any of those people.
So, and then how would you suggest that, you know, an average person develop a relationship with the health partner?
With their health partner.
With
I
theirs?
have
I'm trying to understand the question, Missy. I'm sorry. You said with theirs?
Well, I mean, with a health
Or
partner, like
find
your health. How would you develop a relationship with your health partner?
I have a tool that I have from Compassion and Choices, and the tool is how to talk to your physician / provider.
Mm-hmm.
And you take this tool and you look at it. It has a lot of questions and things like that that you would ask the doctor. Also, the other tool that I have is a diagnosis decoder. Because people say, well, you know, you got diddly wop boot. They be like, I don't know what did that. And you know what most people say? Well, thank you so much. Is this the paper? Thank you for the paper.
Don't look it up
They said,
enough.
I got diddly wop boot. And what? I don't know what that is. But this diagnosis decoder, you can go on there and it tells you some basic information about the diagnosis you've been given and that kind of thing. Because guess what? When you get a new diagnosis of something, you should automatically make an appointment to go back in a couple weeks. You know what? That got to sink in. When you get a diagnosis of something, you already know that you're going to have to make a life change, and you ain't going to get it at that doctor's appointment that they tell you when they tell you that day. You got diabetes. Oh, here's the pill. All right. No, you got to come back again and say, so listen now, now what are the things that I'm supposed to do? You know, I read this, and this. Is this what it is that you like for me to do? You know, so that you can go really look and see what the standard is, what it is, and then go back to the physician and say, are these the things that you want me to do? Because I'm not really sure. You really need time to think about what it is that they've told you and what it is that you have, so that you can go back and get more clarification of what you need, instead of making 15 phone calls. Oh, you wanted me to do that? Because then you're pulling pieces together and you still don't really know wholly what it is that you need to do.
Can I ask a question, Toya?
What?
She said, what? My question would be, if your doctor has planned for you to do, you know, A, B, and C, and your health insurance deems, because they've seen previous things and their doctors say that they don't need that, what is that piece? What should we do in that piece?
In that piece, and you know what, that happens quite a bit because of, and that's a very, very good question. That is a very good question. So the doctor has ordered something for you. It needs pre-authorization from the insurance company. You get the pre-authorization and the insurance company says no. Then you go to the physician and you say to him, you know what, they said that they're not paying for this. and they gave a reason why they aren't going to pay. Can you tell me why you think that I need this? What is the outcome from this? Is it to clarify something? Is it to diagnose something? Is it to clarify something? Is it to show disease progression? What exactly is it that you're trying to do? And then when the physician tells you that, then you can make the decision whether or not you think that is something that you should have, or you can talk to the physician and say, oh, okay, well, you know what? I agree with you. I think that this is something that I should do. So I'll give you a perfect example. You have someone, they have end-stage dementia. They're unresponsive. They don't walk. You take them to the doctor for whatever reason, and the doctor says, oh, you know what? I want to get a CAT scan of the abdomen. You need to get a pre-authorization. And they said, no. So you would ask the physician, now, do we feel like it's something acute going on? By acute, I mean that is something urgent going on. Mm-hmm. If it is something urgent, is it something that we're going to treat? Because you know what, if the answer is yes, and they'll need surgery, then you need to have it done. If it's something that just because the physician wants to know, is it worth it to put the patient through?
Mm-hmm. So like, for instance, I don't mind never talking about myself or my children, because I believe that only the way people can learn. Mm-hmm. So like I said, my daughter has epilepsy. Mm-hmm. And one of the reasons why I'm just perfectly thankful that she's never had COVID is because, you know, vitamin D is very deficient in a lot of African-American children, mm-hmm. or whatever. So, you know, they were told to stay in the house. So her insurance company said, well, we're not no longer paying for vitamin D. And I'm going back and forth because I know she needs this vitamin D because she's deficient. Mm-hmm. Back and forth, back and forth.
What does back and forth mean? What does back and forth
mean? From the doctor trying to get them to pay for it, the health insurance doctors tell me why they said that I don't need to pay for it. So the health insurance doctor said that I should be able to let her go outside more often. I said, sir, do you know we're in a pandemic? I'm confused.
Did you write them a letter?
Yes, you know, it took a while.
Okay.
It took me maybe about 6-7 months to do, but it's just still the being one that you have to be on them. Like you can't just.
This is the thing. You don't have to. You don't have to do a whole lot of phone calls back and forth. If it's something that you need to have done, you make a phone call, and if you don't get the results that you need from a phone call, then you write a letter, because from that letter, that first date, most insurance companies, and I'm talking about insurance companies because it usually has to do with something being paid. Most insurance companies, when people have some type of complaint or whatever, they have a certain amount of time that they must become compliant in if it's in writing. So if you talking back and forth,
late. Yeah, I had learned that later, but that's why I said I was going.
Don't do a whole lot of talking.
And then then somebody like yourself said, Renee, what is wrong with you?
You know,
I was like, what you mean? But
put it in writing. I'm sorry, I don't understand this, and this. The physician said that my daughter needed vitamin D for this, and this. This is my request to have the medications paid for. Please contact the primary care physician. So what you do is this. The other is you send a copy of the letter to the physician. You send a copy of the letter to the insurance company, and then you send a copy of the letter to the local Department of Health. Okay. Because if it's something that they're saying that your child needs and the insurance company won't pay for it, I'm sure that that's something that the local Department of Health would want to know.
Yeah. These are the nuggets, guys. These are the nuggets that you don't know that you're not getting. So please pay close attention, because this is exactly how you get it fixed. Don't wait like I had to wait. You're finding out firsthand information right here, right today. You know, Toya, I'm so sorry. I have to jump off, Toya. I got to deal with the baby girl. But thank you so much. Your name is Missy. It was lovely meeting you. Thank you for answering all my crazy questions. I
Oh,
appreciate
no
it.
worries, no worries.
So
One,
Missy, like,
yes.
so how do you think you would, how should someone select their healthcare provider then? Like, how do you?
I think that you should um, think about location, because that's important. Also the specialty, based on, I know that a lot of people see specialists and things like that. You may see an endocrinologist if you have diabetes. And you, Toya, that's another thing that you may need to look at for your sister, an endocrinologist.
Yeah, how do you spell that? No, we'll talk offline. Go ahead.
Oh, we'll talk offline. Or if you see a cardiologist, if you have a heart problem. But the other piece too is to have a physician that is connected with other specialists. Because if you have somebody that's just out by themselves, then when you need a specialist or whatever, you may have to find your own. Now, sometimes you may have to find your own specialist because you have to go to a doctor that your insurance covers. So that's something to think about too. And guess what? In some insurances, you may have to pick your primary care provider from the list of people that they have, unless of course you want to pay out of pocket and be reimbursed at a lower rate. I have done that in the past so that I could keep the physician that I have, but the physician that I have right now, I like a lot. But you can take a look at the list of providers and find out where they are, find out what their specialty is, find out what their office hours are, if they have weekend hours, also if they have somebody that covers for them when they're not there. Those are questions to ask. Can you pop in? Do they have do they have other services there? So can you get x-rays at the same location, blood work at the same location, all of those things, because that makes a big difference in where you go to. If you go to the doctor and he says, well, you know what, I want you to go get blood work, and you got to get on another bus and go 20 miles away, or 10 miles away, that makes the difference in where you go, especially if it's somebody older. The other is, think about it. If you're not feeling well, you don't want to go to all of those places. You want to go, which is why people use the emergency room. They say, well, why don't you go to your primary care? Well, if I go to my primary care, I got to go there, and then he's going to want me to go get lab work, and I got to go someplace else. And then I got to go get an x-ray and this, that, and the other. But if I go to the emergency room, they're going to do everything right there. And it's not the best thing to do, but when you're older, you don't have a ride and you don't feel good, that's what you're going to do.
Well, it's funny you say that, because a few weeks ago, my mother's feet swelled up, right?
Mm-hmm.
And then they started to get dark. Mm-hmm. So, I had spoke to one of my friends who's a nurse. She's like, if they're changing colors, you really need to get her to the doctors, right? Mm-hmm. So instead of going to the doctors, I took her to the emergency room. And right. The reason why I took her to the emergency room is because I know they're going to take the blood work. They're going to check it right away. They're right. going to take x-rays. They're going to check those right away. They're going to check out her heart to make sure she ain't having a heart attack or stroke or something like that, Right. And she's 92 with dementia, blind in one eye. Right. She's a beast, though. Don't get it twisted. She's the goat. She's a goat. Right. But at the same time, I was talking to my sister, and it was on the weekend, Missy. Oh, and
that's a lot.
It was like, okay, do we wait until Monday and go to the doctor, or do we? And that's the other thing with like the local hospitals, treating everybody in the neighborhood. They're busy,
right?
And it's like, how do I let my 91-year-old mother during a pandemic sit in the ER room? So that was something else to consider. Right. But we waited until Sunday because we knew it wasn't going to be so bad, because it was either go to the doctor on Monday or go Sunday. Then we drove up to Chestnut Hill, not up the street, because they're taking care of the emergencies because of all the other disparities in Philadelphia, namely like gun violence, So instead of being in that emergency situation like that, we took her up to Chestnut Hill, and it was very pleasant. And they was like, she just has swollen feet because she's 92. And then it's like, she just has swollen feet. I'm like, I thought I was gonna have a heart attack. I thought my mom was dying, and it's just swollen feet.
Well, it's scary. It's scary.
Yeah.
And
Yep.
that isn't a good explanation. That isn't a good explanation. You know what the good explanation is? Your mom is bedridden or chair ridden most of the time. And because of that, she has settlement of fluid in her legs. So that is why her feet are swollen. If she's more mobile and you reposition her more often, if she can tolerate it, it will decrease the swelling. But you don't tell somebody, and that is the point that I'm talking about. This is why people are nervous. It only took 2 more minutes for me to say what I said to you. Your mom is not as mobile as she was, and that's why she has the swelling in her feet. Older people have a tendency, everything drains to the bottom. So unless they're more mobile, you're probably going to see more swelling in her feet. That's what they should have said to you, not your mother got swelling feet because she's 92. That part of it is true. But if you have a better understanding of that, then you don't come away feeling like, I'm a fool. No, you come away feeling, well, now that makes a lot of sense. I'll pay closer attention to it. So not only do they get it in their feet, they get it along their back and right at their butt as well.
Well, can you come take care of my mom then? Well, my sister. My mom is taken care of, okay? I need some help with my sister that's upstairs. I really do. I really do.
Your sister is going to be okay.
Yeah.
Diabetes is tough because it's so much that you have to learn very quickly about managing your blood sugar. And it is when it's high, when your blood sugar is high, some people have symptoms, but most people have symptoms when their blood sugar is very low. And you just have to know how to manage it. But you know what? Guess what? Whatever she learns, you're going to have to learn too, because you're helping to care for her.
So let's talk about, since we're here, let's talk about like that mental health piece for the care partner and bringing yourself joy. Let's talk about that.
Ooh, you see, I have to shut my shirt. I don't know if you can see. Wait a minute. My shirt says protecting my mental health 24/7.
That's right.
That's what yeah, just having that piece of it, because people think, people are good for saying, I'm all right. No, are you all right? Oh yeah, I'm all right. But one of the things that I did was I took a class, and the class is called Mental Health First Aid.
Oh, wow.
Mental Health First Aid is a class that helps you to identify when someone is in distress and how you can help them. And it's just like regular first aid. It's not like you're a doctor. You'd be like, oh, you need some medicine. It's not like that. It's just that you're able to identify when somebody is in distress and point them in the right direction to get some help. Having said that, when I took the class, I learned a lot of things about people who were in distress and how I could support them, especially as a caregiver with dementia, one of the things that, people need to learn, especially dealing with somebody with dementia, is shut your mouth and listen. You don't have to be right. You know what a patient told me one time? I'm not listening to you. Your mother is a rocket scientist. You know what I told him? That makes a lot of sense. Now I know why my mother act the way she act. He said, it makes sense. I said, yes, sir, a lot of sense. And he did whatever I needed him to do for that day. A lot of, they say, well, the patient has triggers and that kind of thing. Yes, they do. But you know who the trigger is? We are sometimes, because we won't close our mouths. So part of it, we have to look at us, our frustration, going back and forth, word for word, tit for tat. And also to understand when we know we have to take our time doing the things that give us joy. For me, travel is a lot of joy for me. Also reading and educating nurses brings me a lot of joy. My family brings me a lot of joy. Just meeting new people brings me a lot of joy, but you have to figure out what that piece is and then do it. The other thing is that you have to accept help, and help does not always look the way you think it should. Say, I don't need that kind of help. I don't know what they keep asking me that for. I don't need them to make no chicken. Take the chicken. Because if you feel like you don't want to cook tomorrow, you have it. Somebody is, because guess what? People are helping you in the way that they know how. They may not be able to help you in the way that you need them to. They're helping you in the way that they know how. So you have to be, a gracious receiver. You're a gracious giver because you're giving your time and your care and your love to this person that you love so much. But you have to be a gracious receiver too. Oh, you want to rake my yard? Gosh, thank you so much. Oh man, you're going to sit here while I go to the bank? Oh man, thank you. You may not have a dime in the bank, but you can go out and ride around and get you some Rita's ice, water ice, and come back. Or sometimes you just sit in the house and don't do anything, nothing. Read. You have somebody there that manages everything else so that you can have just some time to yourself. I know that Toya, you like to do flowers. I don't have no green thumbs.
To be honest with you, those are everybody else's flowers. I like to look at flowers. Okay.
Oh,
The
okay.
one thing that I do, and I probably should, you're looking at the page, but the one thing that I do like to do is I like to knit and crochet.
Crochet. I did know that well, you're gonna have to help your girl. I know how to crochet a little bit, but not that much. I can do a chain and I can do a little square, but that's as good as it gets. But you know what? In my quiet time, I will crochet. If I have in my quiet time, I will crochet because it helps me with thinking. It helps me go to a quiet and peaceful place. I will do that. I don't knit as well as I used to, but I have yarns here and there. And when I want to get quiet, and I will pull out my crocheting needles. Sometimes I listen to music. The person that I care for now, she's in her 80s and she likes big band music. So right now I'm listening to a lot of Frank Sinatra, a lot of Count Basie, which I love. And just I'm doing a lot of meditation too. I have the Whilst apps. It's WHIL. I have it on my Apple, and I pull it up every day. I meditate in the morning, and it's just, you can do it anywhere from 5 to 20 minutes. Also, I use it at night to help me sleep. Also, and I just started doing aromatherapy. I was doing candles and stuff like that, but I really like the aromatherapy. I put it on sometimes to help me sleep because I want to calm down from caring for. I'm a paid caregiver, so I have someone that I care for, that's my job, and then I'm a caregiver to my aunt, and guess what? She lives in another state, so it's very, very difficult. Managing all of these different things. And I'm a kind of turn up person. So I had to find a way to be able to be still and quiet, and listen to what I was feeling. Am I upset? Am I feeling overwhelmed? I had to listen to that, because caring for someone else who has needs all the time can overwhelm you. And
so it's so funny. It's funny you say that, because I actually work for a nonprofit called ARTZ, ARTZ, Philadelphia. And what we try to do is bring joy to care partners and people living with dementia. So basically, what they do is they'll find out what brings, like, dementia patients maybe living in nursing homes or something like that, what brings them joy and what gives them peace, in their world, in the dementia world. And then the other thing that we do is we do the same for care partners, because as you, of all the examples that you were just sharing about just being, you know, worn down, always helping someone else, being overwhelmed. And what we try to do is get the care partner out of that worry bubble and get them into a happy bubble. So I would like the audience to look up Arts Philadelphia. It's a public Facebook page, and they do have a website, and that's ARTZ, you know, Philadelphia.org. But the other thing is, Missy, since we started this partnership, and it's 7:02, so I'm gonna hurry this up. We've been on an hour. I can't believe it's been an hour.
Okay.
But since we start this partnership in 1980, well, actually 1974. Okay. I think that, I mean, you have a lot to offer to our community. And I was thinking about putting out a poll to see if they would like us to see us, you know, more like once a month. Like, do you think you would be down to, you know, hang out? And we could go over.
Absolutely support you. Absolutely support you.
That's
There's
good.
one
And
other
then we
thing
can,
that I wanted to bring up while we're on here talking about care partners. And I think that you should research it, and that is respite. Are you familiar with respite?
no.
Respite, it is some organizations, reach out to your local office on aging. Respite is a service that's offered to families who are caring for someone at home, where an organization will pay a caregiver. Sometimes they may give them 4 hours of respite. Sometimes they may give them
I know what that is.
so that the person can go do whatever it is they need to do. So for instance, I had a family one time, and I connected them with an organization that gave them respite because the caregiver had to go have surgery.
Right.
So they had someone come in for respite to care for the family member so that the caregiver could go have surgery and then come back. And respite is a good way to for a caregiver to get away for a couple days. Usually there are people to train that they're trained people that support people in their home. And if you don't have, I can certainly start to look for some respite organizations. And you know, most people start out with just a few hours of respite because they just be like, okay, deuces, I'm going to Vegas for a week. It's not like that. You know, people are very funny about people caring for their person.
Right.
But you know what, it's something that as a caregiver, you may need to do. You may need to have a day where you don't have to worry about, not only, even if you have somebody to do the care, not worry about the person that's going to do the care. You have to have, even if you don't have to physically do it, you don't have to worry about it. That piece of it, you know, is what the respite is also helpful to too. And also it gives the patient some different people to interact with, because sometimes at home, you know, it's kind of the same thing going around and around. Now, we haven't done a lot of visiting because of COVID, but it's certainly something to think about. And it's certainly a service that I know that when people use it, they're very happy with it.
Well, I really appreciate you being here. And I would like to, when you're done, share our yeah, everybody out there sharing, like, it's probably like 4 people watching right now, maybe 3 or 4, but once we share up and everybody gets, you know, it's kind of like dinner time, people are busy. Maybe we could do an afternoon or a different time, maybe a Saturday, you know, when we get more attractive people. But I just want to thank you so much.
Thank you.
And I'm gonna put that poll out and see, you know, well, in fact, Missy, yeah, invite some of your friends to the Facebook group. I really appreciate your, you know, all the, as the young folks said, the gems that you dropped on us today. I took plenty of notes. Okay. And I really appreciate you being here.
It is absolutely my pleasure. In any way that I can support your efforts, I will.
Okay.
All right.
And goodbye, everybody.
So long. Thank you.